Hello, hello, hello. This is Tooth Be Told, Dr. Dumpert.
Dr. Walter Ackah.
Dr. Aovana.
And Dr. Aovana, it's actually kind of amazing. She is in Australia right now, so we were trying to fight different time zones, but we got this correct. And she was gracious enough to stay up really late to come on this podcast. So we're excited about this, Kyle. And
Yes,
on top
absolutely.
of that, she's been listening to us for a while. So the first question I have is, how the heck did you find us? How did you find Tooth Be Told? That was the first thing I was like, how the heck did you find us?
So last year, we had a lockdown in Victoria, in Australia, for 6 weeks.
Mm-hmm.
So I was doing a lot of running at the time, and I was training for a marathon. So I sent out an Instagram story asking people for recommendations on books and podcasts to listen to. And a very kind endodontist then suggested your podcast to me. And once I started listening to it, I was hooked. And I just thought that the topics that you present were very relevant to dental professionals.
Okay.
And also very interesting for me because I could then understand the differences in the way dentistry is, done in US compared to Australia. And also I really enjoyed the sense of humor that you guys bring on the show as well.
Oh, good.
Right, we should have recorded that. We're going to record that and just play that over and over again.
Yeah.
Really?
What a great way to start my day. This is awesome.
Man, that was actually way better. Kyle, we're officially kicked off our own podcast. We'll just have her just host it from now on. That was amazing. Thank you so much. So I guess the first question I want to ask is, let's get your background. Get your background, and then I have so many questions that I just want to know, just the difference, like you said, in the U.S. versus Australia. But what's your background? Tell us a little bit.
So I'm an endodontist practicing in the city of Melbourne in Victoria in Australia at the moment, and I work part-time in private practice. And I also work at the emergency department of the only dental hospital here. And I teach Doctor of Dental Surgery students in endodontics. And I also examine dentists in the Australian Dental Council and also for the Royal Australasian College of Dental Surgeons.
Wow.
And I also do a part-time PhD as well at the moment in education and endodontics.
Kyle, we need to do more. We need to do better.
Yeah. Wow.
We need to do better.
I don't feel quite as good anymore this morning.
No. I woke up. I woke up feeling okay about myself, and now I feel like I have to go do a PhD in something. That is okay. Wow.
Can we dive into some of that stuff that you just mentioned? You said a dental hospital, so we don't have dental hospitals in the United States. Can you explain what that is?
So we have this public dental hospital where patients who are disadvantaged in income or if they are pensioners, they can go to the dental hospital for treatment at a reduced fee or no fee at all, depending on their situation with their finance and income levels. And also it's a place where the students actually work on patients as well. And when patients are seen by dental students, they get treated for free.
Okay.
Yeah.
Kyle, that kind of sounds like Catholic Charities.
Yeah. So we have private.
Like nonprofit.
Yeah, we have nonprofit private things along that. Is it associated or inside a regular hospital, or is that just a standalone thing?
No, there's when you go to the dental hospital, you can't actually use your private health insurance to pay for dental treatment there. So yeah, and even if a patient has private health insurance, if they go there, they still have to pay the standard fees there. Yeah.
Okay.
So, and the government runs this?
Yes, that's right.
Okay.
Yeah.
So it is government run. Okay. Okay, you also brought up the fact that you're an endodontist.
Yeah, that's right.
How long? So how does that whole thing work from when you're in high school, dental school? Do you go straight to dental school? Do you go into college and then dental school? Like, how does that whole process work?
So when I did my basic dental degree, it was still a bachelor degree at the time.
Okay.
So I finished my basic dental training back in 2001. And then subsequently, I continued with a full-time postgraduate course to specialize as an endodontist, which takes 3 years.
Okay.
And it actually involves minor theses as well, and also seeing patients full-time too.
Oh wow! And so when you were done, you started right out of high school when it came to being a dentist, like straight out of high school.
That's right.
Went to your training.
That's right. So I did at the time I did the UK system, which was like the O and A levels before I went to university. Yeah.
Okay.
So my brother lives in Australia, and he's been trying to. He would like for me to move to Australia, and he's been trying to convince me for a long time. You've been listening to our show for a while. What do you see as, from what we've said about dentistry in the United States, what do you see as the biggest difference between dentistry in the U.S. versus dentistry in Australia?
Well, besides the fact that we're always bitter, but besides that, and Kyle hates insurance. Besides that, what are the differences?
I mean, I can only probably speak from the point of an endodontist,
right?
Because I'm sort of comparing, how endodontists work in Australia with endodontists in US. And I would say that over here, we have a very small group of endodontists. For example, in my state, we have 35 endodontists working in private practice, serving a population of 6.6 million.
Wow.
Yeah, and among that, there's only probably about 9 females out of the group. So we are quite a small group of, specialists compared to, like, say, in US, you have thousands,
Right.
Probably.
Why do you think that is? There's such a small number of endodontists.
I think it's partly because of the history and the fact that we have only 4 dental schools in Australia that could train specialists at the moment. I think it's related to manpower and also resources at the universities.
Okay.
So I think because of that reason, each year, each of the schools may just take in 1 or 3 students a year to train. So there isn't a very high turnover of specialists in that sense.
Well, so with that being said, there's a need for more dentists, more endodontists, more whoever, right? Is it easy to get a license in Australia if you're coming? Let's just say Kyle wants to move to Australia, not because of dentistry, because he likes to surf a lot. But let's just pretend that Kyle also wanted to do dentistry. How easy would it be for him to get a dental license?
I think you have to go through definitely examinations set by the Australian Dental Council. So it involves theoretical and practical exams.
Okay.
And also you have to go through some PLIVO, OSCE exams as well. It is probably going to take about 1 or 2 years to get through the exams. And it can be quite expensive and quite, I think, tedious as well. Yeah.
Okay.
I think and if you are a specialist, I think the process is even more tedious because you have to sit through interviews, you have to present case reports. Yeah.
Okay, so Kyle, you can go. I'm not.
Welcome to come here and just give it a try.
Right. It's like 3 years later, I'm still not in. They're like, this guy is not that good. So another question is, when it comes to demand, right? Insurance, the way in the US, the way insurance works is basically they kind of use us against each other. And Kyle, tell me if I'm wrong at any time here, right? There's a lot of dentists going after a small population sometimes in the city, right? So it's kind of like, to me, I look at it as kind of like fastest to the bottom, right? If you'll take, if Kyle and I are next door and Kyle's going to take $100 for a cleaning and I say I'm going to take 90, the insurance is not going to sit there and say, oh, okay, fine, we'll give it to Kyle. They'll basically lower the fee, right? So we're competing against each other. In Australia, you said you have 35 endodontists?
Yeah, that's right. Yeah.
So does that mean that they can?
Yeah.
In private practice. So does that mean that they can actually control the level of fees and so forth, or how does that work?
So we are not actually our fees are not being controlled by private health insurance at all. So we set our own fees.
Right.
And the insurance companies may pay like 10% or 5% out of those fees. Unfortunately, the insurance companies, they don't pay a lot of the specialist fees.
Mm-hmm.
So in general, patients, they will feel like they don't get a lot back with when they see a specialist. So they know that it's going to be quite expensive. Yeah.
So is it in the United States, we have government healthcare, government dental care for elderly or for lower income families.
Medicaid,
That
Medicare.
Medicare, right. So, and those generally don't, they're really the lowest reimbursement rates that if you're a dentist and signing up for those, you really have to see a lot of patients to make that work as a viable business model. But there's also private insurance, and then of course there's self-pay. Is that how Australia is set up too?
Unfortunately, over here, the government actually does not provide like insurance to people with lower incomes for dental treatments, but they do have community clinics and the dental hospital where the patients can access subsidized treatment or treatment without paying a cent as well, depending on their financial situation. Yeah.
Okay.
Well, I got another question. So when it comes to, and we're probably going to do insurance a lot because we talk about this, and it's amazing to us that there are other types of insurance and other thought processes.
Yeah,
So
sure.
ready. So I don't have insurance, or the government doesn't pay, or my insurance doesn't really cover that much, right? In the U.S., I've noticed when insurance covers a lot of treatment, patients don't take the treatment that you do as seriously. Oh, okay, well, whatever. I'm getting my filling done for free, or it's very reduced price. But if you're having to come out of your pocket for a substantial amount, like a root canal, right? You're going to take that seriously. It's like, I paid a lot for this, so I'm going to actually take care of it, maybe get that crown that I need on top of that root canal tooth. Do you find that a lot of patients are really serious about, taking dentistry and dental health a lot more serious in Australia?
I think that patients would want to know when they attend for the consultation, they would like to get as much information out of the consultation as possible to make a decision. And some patients do go around to different practitioners and get a second opinion as well before deciding to proceed with treatment. But I do understand, that if a patient has 100% cover for insurance, they might think, okay, then I'm more than likely to proceed with the first person that sees me. I can understand that mentality. But over here, I find that, a lot of patients here would actually get a second opinion or even third opinion sometimes. Yeah.
And
before they proceed. Yeah.
Go ahead, Kyle.
With what's the overall, I guess, dental IQ of the patients in Australia? Is there a big emphasis put on how dentistry affects your overall health? In the United States, I'd say it's probably 50-50 as far as people actually valuing what's going in their mouth or saying, if insurance covers it, I'll do it. Otherwise, I'll just take the tooth out, that kind of thing.
Yeah. I think the fact that I work in the city means that I will see quite a huge sort of variation in the type of patients. So, if you're talking about dental health literacy, I would say that I get a really good mix of people who know a lot about dental health, and I also get a mix of people who don't really know much about it. So yeah, I say I get a mix of it. But in the past, when I used to work in a practice where we do, at that practice, we were seeing patients who were of a higher income level. then I would say that the patients were a lot more well-informed and also more highly educated and, ask questions to a greater detail as well about their treatment.
Okay.
So let's change over to COVID, right? We had a whole year and then some. Is still going. A lot of people don't think it is, but it's still going. We're trying to control a lot of this stuff. And the dental and Kyle and I, you probably listened to us when we were going through the whole COVID situation, just basically all the craziness and everything that we went through. We were shut down for only emergencies for about 2 months. Kyle, how long were you shut down in Pennsylvania?
Completely shut down where I couldn't have anybody walk in the door for a week.
Right.
Dental emergencies only 2.5 months.
2.5 months, right? And we were about the same. We could only see dental emergencies for about 2.5 months, and then all of a sudden we're back, right?
Okay.
Right.
And then there are different theories. Okay, well, we wanted to save the PPEs for the emergent hospitals and so forth to treat patients, and then others were like, well, no, we just couldn't get PPEs, and we don't know if dental clinics will increase the spread of COVID. There were so many things going on. So I wanted to ask you guys, how did Australia handle COVID and shutdowns, and why was the reason for the shutdowns in your end?
I feel like, they initially sort of decided to have the lockdowns because it worked for New Zealand. So New Zealand sort of shut off its borders, international borders, really early on.
Yeah.
When the pandemic happened, and they saw that they had success in reducing the number of new cases. So I think Australia just followed suit, and therefore then closed its international borders really early on as well. With the lockdowns, I think initially they thought if we do have a very strict lockdown and turn our state into a police state, we could control this disease and actually eliminate it. So I think they were thinking, of doing that at the start. But I think it's becoming more and more apparent to everybody. I think now that I think lockdowns are not really the way to go. And, it's going to affect, the mental health of people. It's going to affect the economy, businesses. So it's very tough to actually go through a lockdown for a lot of people. And for dentists as well, a lot of them have to reduce their hours, shut their practice down. But it depends on, I guess, which area of dentistry that you practice on. And some dentists, they focus mainly on cosmetic dentistry, and I think they were really quite badly affected. If their focus is on periodontal, management of periodontal disease, and they were quite badly affected as well. So, so I think it depends on the area of dentistry that you work in. And for me, for example, as an endodontist, I actually did not stop work from April to December, despite all the lockdowns, because I deal with patients with pain, swellings, dental trauma. So I was kept really, really busy. Yeah. And also I work in the emergency as well. Yeah.
Even the United States, I mean, it wasn't just dentistry that they shut down. It was pretty much any surgery. Even if you had a broken hand or something and you tried to go to the orthopedic surgeon to get your hand fixed or a broken bone fixed, they were turning people away, saying the government has completely shut down any kind of, other than life-threatening emergencies. They weren't allowing any kind of medical treatment, let alone dental treatment or anything else. So was that same thing happening in Australia, where the government was controlling what you could and couldn't do as a health provider?
Yeah, definitely. So the governments did provide all the dentists and specialists with guidelines on, what you should do, and what you should do in your clinic to change the way you work. For example, like even using a high-speed handpiece, with water. So I think, definitely guidelines were set out pretty clearly from the start when the lockdowns happened. And it made it very challenging for a lot of clinicians.
Challenging for patients too, because they aren't able to get the care they needed. With fast forward to now, I think things in the United States have, at least in my area, they've been back to normal in my area for a long time. Most of the country with vaccinations is getting back to being normal.
Mm-hmm.
With Australia being locked down for so long and it being so difficult to get into the country with mandated quarantines once you get there. My understanding is things have been back to normal, maskless, because Australia controlled the disease so well. Looking forward and how things are now, are there vaccinations being done in Australia? Is there any worry that when the borders do open back up, there's going to be a huge surge of COVID since it hasn't really hit Australia?
Actually, it's funny that you mentioned that and asked that question because currently I'm actually in a lockdown in Victoria at the moment. Yeah, so we're in our 4th lockdown, and because we had a surge of new cases that were spreading in the community. So it got to about, I think, 5 cases at the start when they decided to implement the lockdown.
You mean 5 cases a day?
A day, yeah.
Oh, Jesus. That's like the beginning of COVID here. That was like the first day of COVID. And we were like, yeah, we're fine. We're good. Keep moving.
And I think we really didn't have any new cases for about, I think, 86 days prior. So a lot of people then did not want to have the vaccination because there were side effects associated with it. And also there's also a regulation here that says that if you're over the age of 50, then you will have to have the AstraZeneca vaccine, and that led to some patients with blood clots and end up at the hospital as well. So I think because of that, because of the news reported, and also because of the few number of new cases in Australia, I think people were thinking, I would rather not have the vaccine.
Yeah.
And, because my chance of catching COVID is very, very low.
Yeah. Well, it's not just you guys, because I know for us, Johnson & Johnson, the media also reported blood clots with that, and that scared a lot of people, and then they had to shut that down for a while. Right, Kyle, if I'm not mistaken. Yep. Right. Yep. So yeah, it's not just Australia. I think everybody's just kind of weary on what to do next, what's going to happen,
Yeah, that's right. Yeah. And so, I think that once the borders open again, I think that they are currently trying to make some changes to the hotel quarantine system, because in the past we had travelers from overseas staying at hotels in the city, and that led to some outbreaks. So currently they're trying to set up sort of quarantine systems that are just designed for international returning Australians. Yeah.
Don't let Americans in. We mess everything up. Don't let them in. Kyle, you're not allowed to go there now. I know how crazy you guys are. No, I'm messing around. We've just lost everybody that listens to us in the U.S. But let me ask you. So you're a teacher. You're a professor, right?
I'm not a professor.
Okay. Oh, sorry.
Yeah, I teach at the student teaching clinic, and I just help them out looking after patients for endodontic treatment. Yeah.
Okay, well, I'm sorry because you have too many titles, and I would think that you being a professor is probably the least of your titles. But so you teach students, right?
That's right.
Can you tell us, listening to what we talked about in the last episode about students and just kind of in general, listen to some of the stuff we talk about when it comes to the education, dental education, right? How minimal now is kind of the minimal amount required for graduation, right? Just because of COVID and just in general. What do you see when it comes to the future of dentistry in Australia and how these dental students are graduating? And do you think that they're prepared, or do they need to go to a 1-year residency? How do you see these students for you guys on your end?
They definitely been, the students at my university have been quite affected because we had 4 lockdowns, and the other states in Australia haven't had that many.
Okay.
And they do lack, clinical time with patients.
Yeah.
Compared to, say, the previous students that graduated 2 years ago.
Yeah.
And so they do worry about it as well, because they feel like when they graduate, they're going to be less proficient carrying out some procedures. But I always say to my students, no matter what you learn at university, that's just like your basic foundation. Because learning is like a lifelong process. Once you get out of university, you're going to continue to learn. It doesn't stop. Unless you stop it yourself.
And a lot of people do that. Do that.
Exactly. Yeah. So, and also once you get out to private practice, depending on where you work or in the public system, you might be seeing a lot of patients that require dental treatment. So your experience will build up over time. But I think it's important to have definitely a good mentor and a supportive environment to work in, so that you can actually progress your learning along the way. So having an internship is a good idea, I think. Yeah.
Continuing with the education, we're going to hit one of Walter's hot topics. It would be tuition and cost of becoming a dentist in Australia, because it's pretty exorbitant here in the United States.
It's ridiculous.
500,000 or more is not uncommon for students to graduate with. What is it like in Australia?
I think for the local students, you wouldn't pay that much compared to an international student. But from talking to, say, my students from Canada, they pay about, I think, $75,000 to $80,000 a year for a 4-year course. So that's still quite a significant cost. On top of that, they have to consider their accommodation, their living expenses. On top of that.
So do you have a lot of foreign students that come to Australia to study?
Yes, we do. We do in the past. So we do have a good number of Canadian students at the university. Yeah.
Okay. Yeah. And so what is the tuition if you're Australian born, Australian educated?
Okay, so just to give you an idea, when I was going through my specialist training, I paid probably about $35,000 a year for 3 years.
Okay.
Yeah.
Okay, so it's actually about the same, relatively. It's about the same. Wow. Okay, I was actually expecting way less, because I always assumed that other countries are not as greedy as we are. So I assumed way less. I really did. I was like, because remember, Kyle, when we interviewed the one dental hygienist from India, she actually had her doctor's degree in India, and she said she was paying like $100.
Yeah, some ridiculously small number. Yeah,
right. Because I think the rest of it is subsidized by the government. So you're saying in Australia that's not the case at all. I mean, it's pretty substantial as well then.
Yeah, definitely. And so a lot of students actually end up doing casual work or part-time work to help to pay some bills.
Okay, so does that mean that the government? So here, right? Whenever I'm applying for dental school, it's really easy to get student loans. I usually get federal loans, grants, scholarships, and or private loan to pay for everything, so I don't have to work at all. So while I'm in dental school, most of the people don't work while they're in dental school. How does that work for you guys? How do you guys get loans? Do you get anything like that?
There's definitely a loan that you can get from the government. So basically you get the loan it's quite easy to get the loan, and then you just pay back the loan when you graduate. After you graduated and you found a job, and then you can pay back with time. But I never was able to get the loan at the time, because at the time I was a permanent resident here. So you have to be a citizen in order to actually be entitled to a loan like that.
Okay. coming out of dental school in the United States, I think we're about 20% corporate, 80% private practice still.
And it's growing. That number is growing. I think we're going to hit 25 pretty soon here, Kyle.
Yeah, corporate dentistry is growing in our area. What is the employment options in Australia?
I think that private practices owned by corporate businesses are definitely growing. But it was back in 2009 when I first heard about them. So they have been around in Australia since about that time. So about more than 10 years now. And I haven't worked in a corporate practice myself. So I've only worked for dental practices that were, run by the owners or run by families. So I can't really speak about those practices, what they're like, but I can, all I know is that they work in a practice where they might be sort of using the same labs to create their lab work, or they might actually be able to purchase dental products at a very reduced price because they buy more in bulk. But I really can't comment too much about the corporate side of things. Yeah.
Have you heard any horror stories from friends that work in the corporate environment that you could tell us? Because that's the one thing that, not to say that this podcast is biased, but I feel like sometimes we can be. And we don't hide that. I think the golden years of dentistry was whenever you could open your own practice and just kind of say, hey, come in, and everybody would come in. It's changed in the US a lot. But how is that, because now you guys seem to be kind of heading towards where we were back in like the early 90s, when corporate wasn't really as big as it is now. So you guys seem to be transitioning. So you guys are like maybe 20, 30 years behind us when it comes to the corporate lifestyle. So how do you see that affecting dentistry in Australia?
I haven't heard that many horror stories, to be honest, but I've only heard once from one of my previous dental colleagues that told me that, for example, she wasn't able to order like a certain shade of composite resin unless she made a certain amount of money that month, and to use on the patient. So that, to me seemed quite ridiculous at the time. Quite ridiculous at the time. But that's what I was told. And they have maybe targets to meet per month on how much they need to make. And so I think the dentists who work in the corporate environment may be put under quite a bit of pressure to, in terms of their production.
Can I go into more specific endodontic questions, since that's your main focus?
Since that's what she does.
So technology-wise, cone beam CBCTs are a growing. They're not the standard of care in our country yet, but they are moving in that direction. Lasers in dentistry. Walter's a big fan of lasers.
I am. Love them.
Lasers in endodontics. Is that becoming a larger trend in Australia also? How are you implementing these technologies with endodontics?
I would say that there's quite a huge variation in, like say for CBCT, how often they're being used by endodontists in Australia, and that is actually a topic that's being researched on. But in general, it could be ranging from say 10%. An endodontist could be using CBCT 10% of the time on patients, up to maybe 90% of the time, depending on their treatment philosophies, on whether they do own a CBCT machine in their own practice. I think there's a lot of factors impacting on their decision to use it on patients. But I wouldn't say that it's the standard of care as well at the moment in Australia. But with any new technology, I think that there's always going to be early adopters and also people who lag behind. And we're still learning more about it, and we're still learning how it could benefit us. So I would say that I belong more to the conservative camp, rather than the go-getters and the early adopters. So I'm still a bit conservative about it, because I'm thinking about the extra cost on patient, and also the radiation that I'm exposing my patients to,
Right.
and thinking about the benefit and risk, applying that to them.
So in the U.S., I'm noticing a lot more implant love. Let me call it that, implant love. Where if you've had a root canal
Mm.
and if it's failing or it has failed or whatever it may be, more people are geared towards, instead of retreatment, they're geared towards, let's take it out and place an implant.
Mm.
Okay. For me, I'm like, I place implants. That's a good thing. But I also used to be a general dentist, and I used to think, hey, why don't you try to save the teeth? Because I can't do what God has already done, which is create something that has lasted a very long time in your mouth. I
Mm.
can't guarantee the titanium that I'm going to place in your mouth is going to last that long. So, have you guys noticed that are more dentists leaning towards implant restorations than they are, trying to keep that same tooth in the mouth and save that tooth? And then we'll talk about the conspiracy document that was on Netflix, and if you guys heard about that too. That's another topic I want to hear.
Okay. So I guess in Australia, in general, the patients that I see really want to keep their natural teeth
Yeah.
in general. And also, I think that with endodontic treatment and implant therapy, these are two different modalities of treatment.
Right.
It's like comparing oranges with apples. They're very
Well,
different.
right, and that's what I would think, but not in the U.S. It's either I can get a retreat or get an implant. There is no, this is really different from this, and that
Mm.
seems to be the spinoff. And Kyle, tell me if I'm wrong. That seems to be the
Well,
spinoff here.
yeah, in my area, it's let's just take the tooth out.
Or let's just take there isn't even a, you see, so like the educational level, depending on where you are, it's either take the tooth out, don't worry about doing a retreatment. And I feel like that's where a lot of people are going, or just take the tooth out because it didn't work the first time.
Mm.
Dentists, we have this high bar where if it doesn't work the first time, that's it, right? You don't go
Mm.
get a hip replacement and then say, this hip better last me 40 years. If not, I'm taking my hip out and that's it. It doesn't make any
No.
sense anywhere else in your body, but in the mouth, it does.
Yeah,
So have
why
you
do
noticed that?
Yeah, I've noticed it, but I think that in general, patients are still very rational about it. And they actually, I think in general, when I talk to patients, do you want to have extraction of your tooth, or you want to try retreatment? In most cases, I'll say that the patients would really want to try to save their tooth, maybe because I'm already seeing patients who are already biased in their thought process. Because the dentist would have already screened through the patients and say, do you want to see the endodontist to try to save your tooth, or do you want to take out the tooth? And the patients probably say to the dentist, I want to save my tooth, and then get referred to me. So I might be seeing a biased group of patients, first of all. But I always say to my patients that, if you manage to, say, keep your tooth for another 5 or 10 years, we don't know what further research is going to be done in implant dentistry in the future to change how implants are going to work. And if you think back 20 years ago, I mean, the type of implants that you use now is going to be different to the type of implants that you used 20 years ago.
Right.
And the technology that you have, the way you do the treatment might be different as well. So I guess, I would say to my patients, look, if you go ahead with implant therapy, bear in mind that you need to understand the complications and risks associated with implant therapy, because it's a very different modality of treatment. And sometimes I actually advise my patient to go and seek an advice from a periodontist first before they do come back for endodontic retreatment if they're unsure about proceeding. And then that way they can be very well informed about the decisions that they make.
How about something I've noticed in the general population of the United States is I think as social media and the internet continued to grow, there was a decrease in the amount of civility that Americans show toward either each other or even towards doctors or people of who have higher education that are, we're there to help them. There seems to be a larger and larger patient base of entitlement, not wanting to pay for things, not thinking they have to pay for things, and more so a lack of disrespect with how they talk to not only staff but providers in the United States. And I might sound like I'm overgeneralizing. It's a small population. The vast majority of people are very appreciative of us trying to help them, but there seems to be a growing segment of the population that that sense of entitlement and disrespect. Are you seeing that at all in Australia?
Actually, not at all. I find that patients are really.
We are moving to Australia now.
So what flight do you want to take, Kyle?
Patients actually appreciate, the dentists and specialists much more because they feel like so lucky that they can still access dental care, during times like this, during the lockdowns, for example. And I remember one patient who said to me, you are the only person that I've seen besides my husband for the last month. And I'm so glad to be able to talk to another person, like even just that. So it was.
That's what we need to do. We need to lock patients down so they can appreciate our conversations more. I get it. I'm taking notes.
Because of the lockdowns, when people are working online and not having to go into their offices, I find that they actually come to the practice earlier.
Okay. All right.
So they never run late. And it was great.
This is so different. Like in the US, I'm like, you better show up on time. After 50 minutes, people are like, oh, I was running late, I'm doing this. People are actually showing up early to your appointment. Kyle, we need to move.
I've got patients. We're trying to collect money from patients, and they're sending these long texts saying how we're being disrespectful to them and making them feel like garbage because we're just trying to get some money that you owed us for work that we did. And I just see a growing, or not just dentistry, but I don't like where the overall population of the United States is going because it seems, like I said, a lot more disrespectful. And I know I have some of that in me because when I moved to Hawaii and was working there, my boss, I took some of that with me because my boss has said to me, whoa, just calm down a little bit. You need to have more aloha spirit whenever you're here because things are a lot more laid back, a lot more, and I'm not coming from New York City or a very fast bustling place. So, I didn't know how that worked in Australia, if you guys were seeing that or not, but I guess you're not. So that is refreshing to hear, I guess.
But I do have to mention that it's getting quite common for patients now to take up payment plans to pay for their treatment.
Okay.
Since the pandemic started, it's just that I think having the payments sort of spread out over time really helps patients to pay for the treatment. Yeah.
Okay, so care credit for us.
Oh yeah.
Okay. So continuing education, we talked about that for dentists in general, right? Mm-hmm. And we're noticing more and more that in the US, a lot of general dentists are wanting to take, weekend courses, different courses to try to do implants, to try to do molar endos. So basically do a lot more of the specialty, cases without having to go through specialty training. How is that in Australia? Is that something that's also kind of happening? And not to say that there's anything wrong with that, because I do believe continuing education and learning to do as much as you can in dentistry is a good thing. It keeps you from being bored and being monotonous when it comes to dentistry. But how do you see that when it comes to the dental field in Australia and our companies gearing towards more like general dentists when it comes to these cases and so forth?
Yeah, there's definitely some clinical courses now that teach dentists to, for example, search for the MB2 root canals, place MTA. So there are courses that are teaching dentists to do more complex treatment.
Okay.
But I think at the same time, it's like any other areas in dentistry. There are some skills that will take time to learn. And, it's like, you just can't watch a YouTube video and learn how to do surgery.
No. Actually, there are dentists that do that.
Yeah,
So
you
yes,
can.
yes, you can. In the U.S., you can do whatever you want.
Okay, maybe that's a bad example,
Yeah.
but
In the U.S.,
there are, like, for example, there was, I get a lot of questions from dentists about how to negotiate a calcified root canal. And I say to them, look, we use hand files to negotiate down a root canal that's calcified, and it takes time and patience, because if you rush, if you push too hard, you can actually fracture the hand file inside the root canal. And it's sort of like a hand skill that you pick up over time. It's not something that can be rushed. And so if you do a weekend course, and if they guarantee you that you can negotiate calcified root canals, then I would, be thinking, this is not something that you can just do on the weekend course. It takes really years of practice to get comfortable at doing that. And I think so there's a certain limit of what you can learn on a weekend course. That's all that I'm trying to say.
right.
Yeah, and I think that nowadays, as a lot of education is now online, it seems to me that more and more dentists seem to think that they can just learn a lot through just online channels, which I say to them, unfortunately, that's not the case. You need someone to probably watch you do it and actually guide you through it sometimes, in some of the process that we carry out.
And can I do a follow up? So a lot of corporations are now building instruments to help with the ease of, general dentists doing more advanced cases. They have root canal systems that you just basically take one file down and then you plug it with the gutta percha or whatever it may be. So they're trying to make it faster and less complex to do procedures that are more complex. So, what do you think about that when it comes to that? And Kyle, correct me if I'm wrong. Are you seeing that on your end?
I think there's always
like
a push to do faster, better, but and I'm not the expert, so I'll refer to Aovana. But even if you can negotiate down to the end of the tooth within 30 seconds, you still have that contact time of the sodium hypochlorite to really clear everything out. So I do think there is a push in the United States to go from, we went from hand files to rotary, where it was a 6-file system, went down to a 3-file system, and now it's to a 2 or a 1-file system.
Right.
And to get it to be faster, which may not necessarily be better, but there is a push for that.
Right. And what do you think about that system, and what advice would you give to general dentists that are trying to push towards something like that?
I think that's always been happening in general practice, where they just want a very simple system to use that will actually allow them to perform endodontic treatment as efficiently as possible. So that's been something that's been, recommended, within general practices for a very long time. But I think that, the main thing that I now teach my students is that, one size does not fit all. So, you can't apply, the same, way you say prepare a root canal to every single root canal that you encounter. So you have to be able to determine, the case difficulties and, the differences, and to be able to watch out for, challenges that you might actually face during endodontic treatment, and therefore be able to judge when you would refer to a specialist much better. Because a lot of the times dentists get into problems or trouble when they actually don't realize that the case is too complex for them to manage. and then complications happen, and then that's when they refer on. So instead of actually, spending a lot of time encountering a complication and having an unhappy patient, I think the first thing is to, determine what is actually suitable for you to manage within your ability, and then determine, what's best to refer on. So, and that comes with probably lots of experience with time to judge that. And I think that, even when I was a general dentist, I've gone through that phase before where I take on something too complex. And then I just thought, this is way too complex for me. I wasted too much time. And then, whatever you do then doesn't become efficient anymore. And then you have to deal with a patient that could potentially lodge a complaint or be unhappy. Yeah. And then you waste more time dealing with that as well.
With only 35 endodontists
Yeah.
in your state for 6.6 million people, what is the wait time if I was a general dentist or I was a patient trying to refer to an endodontist? What is the wait time? And if in the United States, there's a lot of dentists that don't like doing root canals, so they don't do anything. Our general dentist in Australia more comprehensive, where they're all trained and willing to do that? Or I guess my question is, are you seeing only the difficult cases? And when's the last time you did, pretty straightforward anterior root canal?
Actually, I can't remember.
So that's a yes. You see more difficult.
Complex patients, and I get the complex cases. But you'll find that of that 35 endodontists in private practice, they're more they're more focused in the metropolitan areas. And in the country areas, then there's just very few of them working out in the country, in the rural areas. So the wait list might be about 2 or 3 months before patients get seen in country Victoria. But in the city, usually, the endodontist can fit them in within a couple of weeks. And if there's an emergency, of course, we try to see them on the day or within 48 hours.
Right. Okay.
Yeah,
it sounds like
long hours as a result of that.
Yeah. It sounds like, Kyle, like no matter what, it's still kind of the same. People don't want to go out to the rural areas to treat patients. They all want to stay within the city. So no matter where you go around the world, we're all doing the same exact stupid things. That's good to know. That's good to know.
Well, I don't know if it's a stupid thing. It's stupid, you're going into the area of highest concentration of people. I guess for an endodontist, you need or any specialist, you need a larger pool of people to pull from. So to go set up in a small town.
But you have more competition.
Right.
Yeah, that's right.
Right. So again, you're pulling from maybe we'll say 100,000 people versus maybe million, and you're by yourself. So you might see more people. So again, I think that, but okay, let's my last question for you. It sounds like we've been talking really bad about Americans, and we don't want to do that. That's not good, right? That's not, most of our listeners are Americans, so we have to be nice. Tell us something good about America. Go.
Nothing.
There it
is. Who's that question directed at?
I'm talking. Okay, Dr. Timmerman. What have you heard about American when it comes to dentistry and so forth? And then the one thing, I joke a lot, but the one thing that we have is we have social media to connect us all, right? That's how you got a chance to hear about our podcast and so forth. So what are some of the things that you're hearing about American dentists and American dentistry that you're like, you know what, I wish we would be able to implement this in Australia? Take your time.
Okay, all right. I feel like in general, I mean, the endodontists I have, been in contact with, they seem to really support each other quite well. And I don't sense, competition between them. That's what I've noticed. I'm not sure whether that's true or not, but they seem to be very sharing with their knowledge. Which I think is a good thing.
Yeah.
where I think in Australia, I think there's a little bit more competition, especially in the metropolitan areas.
Wow.
And I would say that, like if you were, say, a young specialist that's starting out, you'll be thinking about, okay, what is going to make you different or unique to be able to survive in the place that you work at.
Wow.
And why is that dentist going to refer to you instead of your employer, for example, or your colleagues that you work with? So I think that's something that I certainly think about when I was a young specialist starting out, and I try to think about, okay, what sets me apart from my colleagues that will actually encourage dentists to refer to me or other specialists to refer to me. Yeah.
That's amazing. So 35 endodontists,
Mm.
6.6 million people, and there's still competition.
Yeah, there
Doesn't that
is.
sound kind of crazy, Kyle?
Yeah.
Wow.
Yeah.
Okay.
Yeah.
Well, my last question for you.
Yes.
In the United States, you can sue anybody for any reason. So liability is, I think, always at the back of our mind, preventing us from maybe pushing the envelope a little bit when it comes to taking risks with patients, even if the patient understands that risk. And there's really there's lawyers that advertise, no cost to the patient. If they're able to get money, great, the lawyer gets paid. If they don't get any money, it's no cost to the patient, and then it's the dentist that is really having to pay out the money to defend themselves, and you can't recoup that money. So that fear of the law or being sued is always at the back of my mind, and I'm sure a lot of other people's mind. Is that same fear present in Australia? Is there a lot of lawsuits that you have to worry about?
I haven't encountered that many in my career, but I would say that definitely from talking to other colleagues, it is becoming something that it's becoming a problem increasingly. For example, when you treat a patient nowadays, you have to think about, is the patient going to leave a bad Google review after they've seen you? So I think definitely it's on the back of our mind that we need to stay on top of our game in terms of patient care, quality of the treatment, and if the patient wish to push for say treatment on a tooth that is very compromised, and you think that okay, the tooth may not last, for maybe it may just last for 1 or 2 years, for example, and the patient keeps pushing for treatment, then we have to do our best to make sure that the patient acknowledges the risk involved in going ahead with it. Yeah.
Okay.
I'm not sure, like, if you guys use consent forms, we do have consent
Oh God.
that the patient fills in. And if they do wish to carry out, have treatment carry out on the tooth that is very compromised, we do, give them another form to fill in that allows them to acknowledge the risk once again. So we do our best to make sure that they understand the risk involved. And at the end of the day, we have also dental indemnity that helps to protect us as well. And also, we can refund the patient as well to money to help them, if they really feel very upset about what has happened. But, most of the time, I think if it's communicated well in terms of the risks and complications, and if the patients do understand you tried your best to help them with their, needs, then I think most of the time it shouldn't lead to a legal issue.
Okay. So do you have any questions for us about dentistry, dentistry in the U.S.?
I think that would take another podcast too.
I feel kind of bad because we've been badgering you this whole time.
I want to do this. I honestly think that we should set time aside so that you can come up with some good questions, And that could be another teaser. We're doing pretty good with this whole teasing thing. For the next time you come on, and we hope that you do come back, please. The next time you come on, maybe you can ask us some questions so that we can basically answer some of the questions that you may have, or you could even bring a friend on to kind of, general dentist or somebody from Australia that we can also talk to about this. But one thing that I've realized, Kyle, is no matter what, dentistry is kind of the same around the world. We all have to kind of deal with the same exact BS. And tuition seems to be the main factor. Again, I'm going to go back to tuition. You know how much I hate tuition situation. But no matter what, we always seem to have to pay a lot for our education. And then it also seems like once we get out, we didn't learn that much, and we have to continue to learn if you want to be a good dentist. So it seems like no matter what, if you're in the U.S. or if you're Australia or wherever, continuing education is important. You get screwed over with tuition, insurance is taken over, corporate dentistry, it is what it is, and then you just move on with your life. Did I sum that up pretty well?
Way to end things on a high note.
Yeah. No, I joke a lot, but I do believe that, we always think that the grass is green on the other side, when in actuality, it's just, hey, just deal with what you have to deal with and just do the best you possibly can for your patient.
Yeah.
Yeah, definitely. I do agree with that. Yeah.
That's awesome.
Well, thank you so much for coming on, staying up late for us.
Yes. I mean, I want our listeners to understand that you literally stayed up really late just so we can make this work for everybody.
Yeah, I tried not to wear my pajamas tonight.
No, you should have. As you can see, we are not really the formal people, We are not as formal, so definitely come comfortable next time. We thank you so much, Doc. We really appreciate you.
Yeah, thank you for having me. Yeah.